Okay, seeing as the time is 7 p.m., I'd like to call the Board of Health meeting to order. All members are present with the exception of President Aaron Christensen and Board Member Chris Schultz. So first item on our agenda for tonight is our COVID-19 update. I'll turn that over to our health agent, Marty Golightly.
Hi, everyone. Good evening. As far as the COVID update, there's really some good news and some bad. Bad news being that we did have 2 cases in town in the past week, but the good news is that both of those cases clear protocol tomorrow morning, so we won't have any more as of tomorrow morning.
That's good.
We've done really well in the last month or so. Also, some of the cases aren't getting reported to us until they're either extraordinarily close to ending quarantine and or isolation, or a day or 2 before it. So I'm hoping that was just a glitch in the system because of the holiday, but it's difficult to predict. So I'm hopeful that our numbers will continue to be exceedingly low. And I just ask that everybody, continue our mitigation efforts as best we can. And that's really it, which is probably the best COVID-19 update I've given in a long time.
Yeah, that's great news. Uh-oh.
Christina, you're on mute.
Yeah, Christine.
Just kidding. Let's try that again. Okay, any other further discussion on this topic or questions?
Marty, I was just curious if we have reached out to the Commission on Disabilities in town to see if they needed anything additional support from the Health Department or the Board of Health for accessing supports through COVID. If we've checked in with them to see if there was anything we could do better.
We have not. No one from the Commission on Disabilities has reached out to us either. I mean, we made it a priority to get people with disabilities the vaccine early on, but I have not spoken to any of that commission.
Christina, as acting chair tonight, is that something, could we invite the Commission on Disabilities to our next meeting?
Yes, we can. Did you want to take lead on Melissa and reaching out to them, or would you like that to come from our health agent or Aaron or myself?
What do you think is best?
I think it's, well, I don't want to volunteer you because that doesn't sound fair, but I always think it's kind of best. I like to think of like the board, if you have a passion for it and special connection, there's no reason any board member can't reach out directly. I don't want to put the work on you unfairly though, just because you bring it up doesn't mean that you automatically have to do all the legwork. So.
Not a problem. I will reach out. Thank you.
Okay, and we'll note it to add to our agenda for next 2 weeks. Thank you, Melissa. Any other discussion on this topic or questions? Okay, with that great contribution, second item on our agenda for tonight is the vaccination efforts update. I'll turn that back over to Marty.
Our partnership with Bridgewater State's mass vaccination site continues despite the actual closing of the mass vaccination site. So we're hopeful, we're just kind of ironing out some of those details, that we'll still have access to the vaccine, and hopeful that local boards and health departments will be able to order vaccine for themselves in the near future. I don't know when that date is, and there's been no indication that it will be coming soon, but time will tell. We still have access to shots for anyone that wants it, and we've reached out to as many communities in town as we can possibly think of. So if there is someone who has been hesitant, needs education, has questions, or wants the vaccine, please let us know, and we will bend over backwards to make sure that they get it. With the rise of the Delta variant, I know that's a very popular news item now, and I will say that we've known that it has been the dominant strain in Massachusetts for quite some time now. It is also significantly more contagious than the initial variants, but the vaccine seems to have an even better effect than we imagined based on a study that was out of the UK of preventing both hospitalizations and death. Because I'm sure everybody remembers, hospitalizations and death are what they call a lagging indicator. And we know that based on cases and reported deaths, in the UK that the vaccines are remarkably effective against preventing both of those things. So again, please get your vaccine, and that will help us prevent both hospitalizations and deaths. And if you know anybody who is hesitant, please have them call us. I will spend hours on the phone going over both pros and cons and telling you all about it. And if I can't do it, I have some super nerds who can answer even smarter questions than me on call, and they will. So please let me know. It is more important to get the vaccine than I can possibly stress in a board meeting. But if you have any questions, give us a call and we'll do our absolute best to accommodate you.
Thank you, sir. Any further discussion on this topic or questions? Okay, we'll move on. Third item on our agenda for tonight, I had added, it's on our donation bin regulation discussion and a vote. I hope, Melissa and Kevin, that you got this a revision thing through email. And I do want the full board participation on this. So since I was the one that added to the agenda, I do feel comfortable, I'll say, tabling the vote until we have a full group. But I would like to use this time to have discussion about the points, just to efficiently use our time, knowing that Chris and Aaron can kind of catch up. So before I offer my own discussion, can I just open this up to the other board members if either of you had comments or questions before I just start talking?
My only thing, Christina, was as far as what was the impetus? Was there issues prior to the regulations being put in place or being developed with prior issues at locations throughout town as far as the donation boxes?
That's a great question. I might have to lean on Marty because I don't know what the actual item was that prompted the revisions, whether that was in response to something or if it was just maintenance. Do you recall?
This isn't a revision. This is an actual new regulation that falls under the board's purview because it was a sanitary conditions issue. There was a lot of rubbish and just things that should not be there next to the donation bin. It was accumulating, and I had to frequently call the property owners who were trying to do the right thing to have those donation bins on their property to get them cleaned up. And I brought this to the board. Oh God, it feels like forever ago now. It might have been pre-COVID even because of that problem. Then the selectmen, we discussed it with the selectmen, and the easiest way to do it, especially because it was sanitary conditions, was to put it under the Board of Health's purview because it's kind of in the spirit because of the sanitary conditions, and the selectmen don't have a enforcement person, and you guys have a director, so that's what we'll do.
Right. No, that's fine.
That was the genesis.
Yeah, I appreciate the background. I mean, I read through them. They seem to be very comprehensive, and I think give us an opportunity to, when there are issues, to be able to take care of them with the property owner and the organization that is actually doing the collection. So I'm fine with the regulations as written by the law firm KMP.
Okay, great. Melissa, did you have anything on your end?
I did some research to compare it to other communities that have the same regulation, and it was very similar language. So I didn't have any concerns.
Okay, I do want to put a couple of things I have just on the radar today, and we can have these as takeaways because I will make a recommendation maybe that we table this for next time for myself. One thing I wanted to discuss was some of the language about the person that is the owner or the permittee of the donation box has like 1 hour to resolve issues. So on my side, I think there's a need that if it's, public health safety, if it's like rotting sewage, 1 hour definitely makes sense. But for a citizen to be given 1 hour from a phone call that might not even be physically close, that to me just seems too rigid. What I would like to suggest, and I'm open to discussion on this, would be 24 business hours, meaning to say if we notify them Sunday morning, they have 24 business hours, which would be the close of business, I think, like Monday evening, or if it was a business day during the week. And that kind of prevents the situation where something occurs on federal holiday, somebody is out of town during the weekend, which I think is kind of common, and just gives a little more flexibility to people being compliance. So thoughts on that?
I think that's fair. Good point,
No,
Christina.
I think it's fair. I mean, and obviously, if that is a public health, Marty would have the, the ability to, make those take immediate action.
So maybe there's a little bit of a thing in there, like 24 business hours in a situation of public health safety, a 1 hour turnaround, because the permittee does have a responsibility to manage this, even if they're out of town, like they need to be able to call someone. I do think that's fair if it's a public health concern. The other item is just around the turnaround time to issue the permit. And this one, it looks like it was on the original, and it's section 3D. And this is actually crossed out. Applicant shall be filed with the director within 30 days of receiving a completed application. The director shall issue a permit or deny the issuance of a permit. So I don't have a concern with any of the language, but it seems like if we take this piece off, there's no actual regulation on turnaround time. So if you're a citizen applying, it's kind of like you apply and when it happens, it happens. It would make sense for me to have some sort of timeline on how quickly we process these things.
30 days is the standard. That's the general 30 days for food permits from renewal application to issuance.
Marty, I know Aaron had mentioned something about maybe reaching out to council to see if there was any context behind some of these suggestions. I don't know if they ever got back. Nothing. From your side, is there any?
I'm reading this, I did leave in that 30-day section, so.
Section 3D?
Yeah, I did leave in 30 days from issuance or from application. So I will see what mine on my end.
Okay.
And make sure that it is correct and send it out tomorrow sometime to make sure that it should be exactly the same.
Okay. And then I know I invited our board members to comment, but just for sake of formality, did our health agent also have any comments on this regulation or changes? No? Oh, I'm sorry, Marty. I was just inviting you because I think I mentioned if the board had any comments. I was just inviting you as our health agent if you also had any comments.
I agreed with the, I figured I could have swore we discussed this already, so I'm sorry. The
No,
definitely more than 24 hours from cleanup, and I would have gave them up to 72 business hours because sometimes it is very difficult, especially dependent upon the mess, for them to clean it up.
Okay.
And there is definitely a 30-day lead time. It never takes that long, but the standard operating procedures is a 30-day from application to issuance. That's just the magic number in building permits, food permits, and everything. And that's the one that I see in there. But I other than that, it's a pretty standard regulation that fits the vast majority of the surrounding communities and is in keeping in the spirit of allowing them while being aware that they can sometimes harbor pests.
Okay. Any other discussion on the topic? So because this is not a pressing urgent issue, and tell me if it is, Marty, if someone has sewage sitting next to the donation box, I'd like to make a motion to table this to our next meeting, since we only have 3/5 of our board here.
I'll make a motion. I'll make a motion to table the donation bin regulation till the next meeting.
Okay, do we have a second?
I'll second the motion.
Okay, we will table it to the next meeting. Thank you very much. And then our final item for our agenda for tonight is a presentation on the Plymouth County Suicide Prevention to offer mental health first aid. And I'll turn this over to Melissa Pond.
Thank you. And thank you, Jenny Babcock, for being here tonight. Thank you for your patience as we worked through some other agenda items. Jenny Babcock is the co-chair of the Plymouth County Suicide Prevention. According to the American Foundation for Suicide Prevention in Massachusetts, suicide is the second leading cause of death for ages 10 to 34 and the fourth leading cause of death for ages 35 to 54. On average, 2 people die per day in Massachusetts by suicide. The mental health first aid program that can be offered by Plymouth County Suicide Prevention Coalition teaches you how to identify, understand, and respond to signs of mental illness and substance use disorders. Training gives you skills to reach out and provide initial support to someone who may be developing a mental health or substance use problem and can help connect them to appropriate care. I thought it would be appropriate to invite Jenny tonight to talk about how the town of Abington can partner and what we can do as the Board of Health to support that bridge. And with that, I'll turn it over to Jenny. Can you tell us a little bit more about Plymouth County Suicide Prevention Coalition, and then go into more about mental health first aid, please?
Great. Thanks for having me. We love to get in front of the town meetings, especially now with, unfortunately, COVID and everything being Zoom. It's easier for us to attend many of them. So again, thank you. The Plymouth County Suicide Prevention Coalition we're going into our 7th year since the initiation of it. We are one of 10 regional coalitions across the state of Massachusetts. We're actually one of the newest coalitions. And we're also the only state that covers border to border with suicide prevention coalitions that, will train or, make awareness about suicide. Everything Melissa said about the 2nd and 4th leading cause of death in Massachusetts is very real. In 2020, there were 647 suicides in the state of Massachusetts alone. Nationally, there was over 47,000. It was actually 47,511 deaths by suicide just in the United States. And to put that into perspective, and I always say this during all our classes, if you think of Fenway Park and you think of it to capacity, more people die by suicide than can fill Fenway Park each year in the United States. So it's very important that we get out there into the communities, organizations, school departments to give them tools and training that will help in a crisis or during a mental health breakdown even. We are funded through the Department of Public Health. So a lot of our programming, our funding all comes from that, but we also do a lot of fundraisers. We've been very fortunate to receive a few grants from banks or local organizations that give us the funding so we can go out and do these trainings for free. We do not charge for them. Now, because of COVID, there's actually 3 different ways that we can do the training, and there is different versions. Mental health first aid, there is actually an adult version and a youth version, but then there's also one specifically for first responders, specifically for fire EMS, for older adults, and for veterans. I am certified in all of those modules. We are very fortunate in our coalition itself. We have 4 trainers that are trained in mental health first aid. Some coalitions have 1 or have none. I've been fortunate to work with my partner, Paul Gabriel, who's the founder of the Plymouth County, or I should say one of the founders of the Plymouth County Suicide Prevention Coalition. He's traveled internationally doing trainings for mental health first aid, but we've covered all different ends of Massachusetts, whether police departments, fire departments, veteran groups, schools. We actually, not too long ago, we even were hired by Google to go in and train some of their staff in mental health first aid. So we definitely want to get out there and help. We want to help partner. Mental health first aid is a pretty long course. If we deliver it in person, it's actually a 7 to 8 hour course. It is broken out throughout the day between lunch and a couple of breaks. And there's also some class participation to kind of get you up and moving. To sit there for 7 to 8 hours is a long day. They do offer what they're calling a virtual class now, which is a 6-hour class. It is 2 hours of online work that is up to the participants to take, and then it's a 4-hour instructor-led via Zoom. Then there's also what they call the blended version, which again would be the 2 hours prep work and then 4 hours instructor-led in person. So there's 3 different variants that we can do. I will say I prefer to be in person because you feel the empathy of people, you feel the emotions of people that are in that class. And, some people, I am a lost survivor. That's how I got into this. I lost my 15-year-old niece to suicide 10 years ago. So this is very passionate to me. My son also suffers from mental health disorder, and he had attempted suicide twice. He's 28 now, he still struggles, but doing very, very well. So again, this is very passionate to me. Um, Anytime I can get in front of somebody and tell our story or talk about what we do, we would more than welcome it. Mental health first aid is only two of the, youth and adult is only two of the programs that we offer. We have about 5 or 6 other programs that we offer, and they range from 45 minutes to 2 hours. So I know an 8-hour day again seems long if you want to invite the public to. We can put 35 people in a class if we are in person. We do have access to several of the different libraries throughout Plymouth County, Norfolk County, and police departments that let us use their space for training. So if we can try and set something up for the town of Abington, if you don't have space, or if you're not looking to do it in person, we can work with you, we can figure it out. One of the other pros and cons about virtual versus in person, when you do it virtual, it's up to the participant to download the program. And the program guide is about 172 pages. So we were hired by the city of Providence to give training to their employees too. And out of the 3 trainings, only about 5 people downloaded that guide. And that's a big difference than having an actual handbook in front of you. When you attend in person, we give you the handbook to take with you. And there's more information in those books than what we even go over in 8 hours. I open up to questions about the program, about what we do. I would just love to even be able to help any way that we can.
Thank you, Jenny. I'm not sure if I mentioned in my intro, I have taken this course with Jenny and with Paul Gabriel. Paul is currently a resident of Abington, so that was a great connection. Before I turn it over to discussion, Jenny, if there is anyone struggling who's watching this tonight, where can they turn for help?
I would suggest the National Suicide Prevention Line, which is 1-800-273-8255. But there's also a talk line. You can text TALK to 741-741. We do ask if anyone is struggling, please reach out.
Thank you, Jenny. So that, Marty, so my question's for you. How do you think that we can be a bridge to get these free services that Plymouth County Suicide Prevention Coalition can offer here in Abington?
Jenny, if you want to contact me, I can give you kind of a brief overview of the classes we're offering at the Senior Center on site already. I think that would probably be the best way to go about it, because we already had a schedule and a calendar of learning events. And it will be dependent upon your target audience. I know you mentioned veterans. As a vet, 1.5 times the rate. So that's probably the easiest way, and we can schedule some dates to have the course in person. I know I too also prefer the in-person learning, because there's a nuance that can be had at a table that can't be had over a camera. That'd probably be the easiest and most efficient way to do it. And I would turn you over to Lindsay, who is kind of taking the lead in scheduling everything over there and getting that. And we have an intern also working on that. So that would probably be the best and smartest way.
You said the Council on Aging? That's where you do your training?
That's where we've been having our courses for the American Red Cross. And we partner with the library as well. Matter of fact, we just finished a babysitting course there today. So I'm trying to, slowly trickle in these types of things for the town. So, and this kind of fits into my mold of things that I like to do. So thank you, Melissa. And I don't see why we wouldn't be able to do it. I can't tell you I can't tell you the audience. I can't speak to, who we're going to get there, but I'd rather have it and not need it, kind of thing. So.
We always say that people will ask us who should take it. And we always say everybody should take it because you never know when you're going to need it. To take mental health first aid, you do have to be over 18. So there is strict regulations on that. Some of the other programs that we do offer, we allow 15 and up, but specifically mental health first aid is for 18. And then we do a few programs that we go into the school departments and we work with the school departments. And usually the schools we work with probably grades 10 and up to do the different programs that we do. So definitely.
I would say, Melissa, if you wanted to reach out to the school committee and to the, that would probably be the best way to introduce them to the schools.
Great.
But as far as the town, as far as the public, we can add it to our calendar fairly simply. It'll just be a time like, how do you want to schedule it, and like when is the best time frame?
What
we've done, do all that offline, and we don't want to take up anybody.
I was going to say, what we've done in a couple other towns, we've had a pizza pasta prevention night, and we basically open it up to the community and we provide the food, and just basically ask everybody to come and learn about what we do. Sadly, if we put the word suicide in there, people shy away from it. So we try and say, prevention and hitting on mental health disorders and suicide prevention. But that's a good way, we call them town hall meetings, just come out and talk to us. So we could even start with something.
I will happily discuss using the Council on Aging as a venue with Suzanne, and okay. I can't imagine it wouldn't be, an easy thing to set up.
I think it would be good too to have an inventory of, like, the town employees that do have the training, whether it's at the police department, fire department, the different departments, to kind of know, so people could contact those people if there is a need in town. So I think it'd be good beneficial to have almost like, the inventory of everyone that has had the training, going forward, because many people probably have already had this training. And I know the other thing too is with COVID in the past year that there's been a huge spike in mental health issues amongst the, the teen and early 20s, community. So it's definitely something that I think we need to work on and make sure that we're prepared for any situation.
Amy, does taking the training, does it count towards like continuing education for healthcare providers or teachers?
I cannot offer CEUs personally. We apply for it every year, and with COVID, we haven't had the need to apply for it. We usually do get it for first responders. That's an easy one. But we do work with other organizations that can offer the CEUs. They may charge a little fee. That might be something we can cover. I would have to go to my committee about that. But definitely the opportunity is there. And Kevin, just so you know, some Abington police have taken our training. We did a big training before COVID in Cohasset at their Council on Aging. And there was, I want to say, probably 4 or 5 Abington police officers that came. But not every town lets us in, I want to say. I have trained all of Bridgewater and Middleborough Police Department, all of Duxbury. There's actually, and I don't know if you guys work with the police departments, but they have a program called the One Mind Mission, and it's to give them an accolade on the International Chief Association or Police Chief Association. And if they have more than 70% of their staff trained in mental health first aid, they get basically another accreditation. So it's
Okay.
definitely something we could help them with if they're interested.
Awesome. Thank you.
Okay, any other discussion or questions?
The other plug I'll put in there for it is when I trained with Jenny, I really appreciate it. It's such a heavy topic to discuss, and Jenny would put out some sensory tools for us, like pipe cleaners and Play-Doh as the participants, so that as things were kind of stressful, that was just there to fiddle with and play with. And I really appreciated that. So just a plug for how great Jenny is as a trainer, and Paul as well, Paul Gabriel, who she works with. So Jenny, thank you for everything you presented tonight, to the board for the discussion, and Marty for your support in moving this forward.
Jenny, I'm sure Melissa can give you my contact information and my cell phone number.
Follow up. Thank you.
Okay, that is all for our agenda items for tonight. Anything else from any of our board members or health agent off the agenda?
I just wanted to ask, we have one member of the public here, just open the floor for public comment. Is that okay, Christina?
Yeah, absolutely.
Okay.
Is this,
Ellen might not be listening.
I think Ellen might be muted.
Okay, she said no comment. Thank you.
Okay, and thank you, Melissa, for pointing that out. I appreciate it. Okay, anything else? Going once, going twice.
I'll
In
move
that
to,
case,
yep. Go ahead. I'm
oh,
sorry.
what were you,
I was just going to move to adjourn.
okay, do I have a second?
Second.
All in favor, say aye.
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 Okay, meeting adjourned. Thank you all.